watching the award-winning GHS-TV, a nationally recognized student television station.
Hello and welcome to Medical Talk. I'm your host, Betty LaMarr. We're bringing awareness to medical education research. Joining me is Robin Bo-Zarth, representing MERI Genesis. Hello, Robin. How are you today?
I'm good, Betty. Thank you. Thank you for allowing us this opportunity.
I am so excited. I really am. I'm excited about this because I feel like people should know about MERI Genesis and what you do. Let's start it off with, who is Robin Bo-Zarth and what do you do at MERI Genesis?
Well, thank you. Again, I am Robin Bozarth. I am the manager of the Genesis Whole Body Legacy Donor Foundation at the Medical Education Research Institute. I have been with MERI Genesis for 17 plus years and in the medical field for a little over 30. And we're excited again to have this opportunity to talk about education and research in our community.
Okay, so let's talk about the legacy of MERI Genesis. The legacy of body donation. How did that come about in the first place?
So in 1994, Dr. Kevin Foley is the founder of the MERI Center, and we can talk about the journey and how that actually began. And he had a vision with residents and surgeons who needed to further education and research. And actually, how is that going to take place? So he had a vision that surgeons from around the country, and again, residents who are needing this education, where are they going to go and how are they going to get this training? And so again, he says, okay, well, let's see what we can do. And he's here with Sims Murphy Clinic and with the Methodist Le Bonheur Healthcare and Baptist Health Systems. He was able to help start the MERI Foundation.
Okay, so how did you personally get involved? What was your passion for working with MERI Genesis?
So actually, it was a stumbling block for me. I had been in healthcare since I was about 17 years old, and my last 10 years had been in orthopedic surgery, and I felt I had a passion in the death care industry and quit my job and went into funeral care and got my funeral license and said, okay, well, what can I do now? So I worked part-time for MERI, and I was very fortunate to be able to take my field and still become a full-time employee here. And fortunately, I have continued my work here for 17 years and worked multiple departments. And now with the Genesis program and helping to expand that department. So I'm very fortunate.
Okay, so this conversation is so good. And I must say, Robin, in full disclosure, because normally when I do a show that I'm in some way connected to that, I'd like for my audience and the viewers to know that. It's just not another show for me. And I want you to tell the audience exactly what I did, what the terminology is. I always say I donated my body after I passed to science, which is what MERI does. So speaking of that, tell the viewers exactly what MERI does and what you call a person like myself that is already committed and signed the papers to do that.
Okay, so MERI is the Medical Education Research Institute, and that is the bioskills teaching lab that is the essential part of the training for the physicians and hands-on side. The Genesis Legacy Foundation is the Willed Whole Body Donor Program for those who donate their bodies to the advancement of science. Now, MERI wouldn't be what they are without the Genesis donors. So you would be considered a pre-registered donor. So
Okay.
someone who signs up prior to death is considered to be a pre-registered donor, which anyone can do. There is a criteria that has to be met, which we can get into later.
Okay.
But the wording and verbiage for that would be pre-registration.
Okay. All right. So I remember what I loved about it so much, and is that Robin, when I had the good fortune to come along with a friend, her mother went through MERI, donated. To me, if I'm going to have a legacy, that's to me a wonderful legacy. Maybe my body can be used to help future generations. You know, if they could learn anything on my body that would help somebody else, then I feel like my life was well worth living. And I tell people all the time, like when COVID, for instance, Robin came on the scene, I barely left the house other than coming to this TV station, right? And I would tell everybody, I don't want to get COVID, and I don't want to smoke, and I don't want to do any of those things that may affect my body, because I have a plan and a purpose for my body. So speaking of that, is there anything that could be wrong with a person? What if a person had COVID and passed away? Could MERI still use their body?
So unfortunately, there is a criteria that has to be met.
Okay.
Infectious disease is a rule out for our organization,
Okay.
Such as hepatitis, HIV, COVID is considered an infectious disease, sepsis at the time of death.
Okay.
So again, COVID at the time of death. So our criteria would be for COVID, if you tested positive 28 days prior to death, we wouldn't be able to take you, or if you were COVID positive at the time of death.
Okay. Well, MERI is considered NADO, NATO, right? Is it NATO?
NATO, that is correct. So that
Okay.
is a non-transplant anatomical donation organization. Long acronym.
Yes.
That is through the through the American Association of Tissue Banks, which is considered AATB. There are a lot of non-transplant tissue banks across the country. There are only 7 that are accredited, and MERI is one of those. That means that we are not necessarily regulated. We're not FDA or anything like that.
Okay.
But we do have to be held to a higher standard and have to be audited
Okay.
to be AATB regulated.
Okay. Well, we're going to take a break, Robin, and when we come back, we're going to get more into the medical education and research part of MERI. Exciting. We'll be
Sounds
right back. Stay tuned for more medical talk.
Stop! Did you know college debt is the second largest type of consumer debt in the U.S.? Why? Because the required interest paid on student loans causes you to give more than you receive. So why not prevent taking out student loans altogether? Learning how to manage your money is a great way to solve that problem, and there are many tips online to get you that head start. Don't wait until you're drowning in debt. Make college affordable now.
You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm your host, Betty LaMarr. My guest today is Robin Bo-Zarth with MERI Genesis. And we're having a wonderful conversation, Robin, about MERI. And this is so good because I think people need to know about this, right? So I have a question, as I normally do, from one of my viewers or someone that I may mention. They'll say, Betty, what is the show about this month? And I can always ask a question. How does the process work? Say like a person pass away and they are a qualified donor. What's next? Take us through those. I know you can't take me through the whole, but just those steps. How does a person know, for instance, when I pass away, that I have signed my body up for, I say for science to work on?
Okay, so you have two different ways.
Okay.
So you have pre-registration, which is what you are.
Okay.
And at the time of when someone signs their donor forms and sends those in, we will send a pre-registration letter to that individual with donor cards that say, in the event of my death, call this number. We strongly recommend that people let their family know, let their friends know that I'm going to be a donor, because you would be surprised at the amount of people who do not tell their family and loved ones that this is what they plan to do.
Okay.
We encounter that quite a bit. So the process would be, in that event, they call that number and we handle it from there. So we contract with a local mortuary here in Memphis, and we take donors from 18 states. And they can find that information on our website. We would then contract with the local mortuary here, who in turn contracts with a local mortuary in that state to remove the decedent from the place of death, get them into the proper refrigeration, which is required at that time, and then we take it from there. The family doesn't have to do anything further. We will file for the death certificate, provide one death certificate to the family, and then the donor will be with us for 6 to 12 months. Now, if they didn't sign prior to death, the legal authorizing party or legal next of kin can contact us at the time of death. If they meet criteria, we can start that process right then. And it'd be the same exact process.
Okay, well, speaking of the donors, we don't want people to get confused, because there was a question I asked you also. So what is the difference? Because I did join the registry, if you will, for some of my organs before I bumped into MERI, which changed everything for me. So tell our viewers, what's the difference between just being a regular organ donor and donating the body to science?
So that gets a little confusing for people. So people assume that, oh, I want to be a whole body donor, so I'm going to sign the back of my driver's license. So you get the little heart on your driver's license, and they say, oh, so I'm going to donate everything. Well, that's a myth. So that heart only indicates in your state that you have registered to be an organ donor.
Oh.
So that has nothing to do with whole body donation. Whole body donation is entirely separate, and you have to sign up with the institution in which you wish to donate, whether that be a medical school or a private institution like ours.
Okay.
It's totally separate.
Okay, so how does people know? I'm sorry.
Go ahead.
I was going to ask, how does people normally know about you? Because like I said, had it not been for my friend and her mom and dad going through MERI, I wouldn't have known about you all. So how does people know about you as a rule?
So we have never really been ones to promote too much our program as far as the public. We've just started that over the last several years. It's always been by word of mouth.
Okay.
We work with hospices, chaplains, things like that. But we have started. We run ads with hospices and hospitals and things like that. We do provide a word of mouth a lot, but we do work with a lot of local newspapers and things like that as well. But we will not approach a family.
Okay, that's good. Okay, let's talk about Genesis Honoring Life.
Yes.
What is that all about? Let's explain that to everybody, exactly how you all honor life.
So for us, we feel that the foundation plays a very vital role in education and research. And it's very symbolic to us, and one would not exist without the other. So you think about, well, why choose body donation, and what is the donation process? Because when you think about death, most people prefer not to think about it. It's much less plan for it, if you think about it that way. And people have a fear of death. And no matter what culture, religion, country, it doesn't matter. And at some point, you're going to die. We all know this, and we don't know the date, the time, or the circumstance, but we know it's all inevitable. And we want to ensure with our donors and donor families that we honor them at at the end of their stay here. And at even with their stay here, when the donor is in the BioSkills event process, we make sure they have the utmost dignity and respect while they're here. It's like an operating room process. There is no identifying process whatsoever when they are here. When their stay is complete, we ensure that they get home or they can be placed and interred in a local mausoleum in our area. We incur all costs, as we said, for the donor and their stay here. And then we have a donation program, a celebration, if you will, annual donor celebration. Last year, unfortunately, was virtual due to COVID. We're hoping this year that it will be in person, which generally is 500 to 750 individuals at a local facility here in Memphis with a dove release, a Veterans Memorial. And we're just so grateful for the gift that we want to try to find some way to honor the families at all times.
Okay, well, we're going to take another break. This is so good. I'm learning so much. You know, this is an exciting conversation for me, right? Because this is just,
yeah, absolutely.
Yeah, it really is. I just think it's a good thing. You know, we go through this life, Robin, and I think what we leave behind is just as important as what we did when we were living. So anyway,
absolutely.
Stay tuned for more medical talk. I'll be right back with my very special guest, Robin Bozarth with MERI.
Texting and driving, honestly, it's not that worth it. Put your phone down.
You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm Betty LaMarr. My guest today is Robin Bozarth with MERI Genesis. And yes, we are having a wonderful conversation, and I'm learning so much. Okay, now Robin, who can be a donor? What qualifies a person to be a donor?
So, I mean, there are times that Genesis has to limit the acceptance of donors to the program at the time of death. We have to ensure that we have good teachers, but we also have to ensure that they're free of infectious disease so that there's no harm to the learner who is here and no harm to the staff. You want to make sure that they're in good physical condition and suitable to create, a high-quality environment for the learner and their experience. So we have criteria, and anyone can call to see what that list of criteria is. And again, you talk about like infectious disease. And again, all of this is at the time of death. All of that is evaluated. So you can be pre-registered, meet the criteria at that time, and then say you are fine for 20 years and then you pass away from sepsis, then unfortunately at that time we would have to decline the donation.
Okay.
So there is a criteria that has to be met. We do have a weight requirement, an upper and lower, and then again there's a BMI because you have someone who is 4'1", 80 pounds is different from someone who is 5'6", 80 pounds.
Right.
So we do keep into consideration a BMI and things like that. We have a limitation on states. We do take donors from 18 states in the southeastern region. So that is a good expansion. But we also refer to other NATOs, if you will, who are outside of our region if we're unable to meet that. So with that said, you talk about the benefits of donation itself and who benefits from all of this process. You have the patients. So you talk about leaving the legacy. You have the physicians that are come in, not necessarily getting learning what they've learned before and just saying, oh, I just need to freshen up a little bit. So say you have a medical device company that has invented a new hip replacement. So this surgeon's coming in for the very first time and has a donor who's never had a hip replacement done. So they're able to utilize that donor, have a hip replacement done, and then that surgeon's going to go back to their hospital and do that hip replacement on hundreds, if not thousands of patients who now are going to be able to walk again.
Yes.
So that one donor has helped thousands of people who are now able to walk, run, and do things they never were able to do before. And so we talk about transplant donors who are able to help in so many ways, but so are non-transplant donors. So whole body donation is so important, and it's such a passion for me personally. I've had 8 family members who have donated into our program. It's again, just a huge passion for me. You have learners from over 30 countries that have been to our facility. We work with medical device companies. We work with high school and college students who come in and tour our facility and learn, that are going to be physicians, nurses, interns. And we do a lot of community work and give back. We give back over, I think it is 3% that we do to our community involvement, and a percentage of our revenue to all of our local organizations to provide hands-on training for them. Paramedics, other healthcare students and learners, residents, nurses, physicians. So we are very, very passionate about community give back as well, being a not-for-profit organization ourselves.
Okay, so definitely want to ask you this before we run out of time. So how long does like when it's my turn and I'm all healthy and you all accept me, about how long will I be there before, from the beginning to the end?
A donor's general time frame is 6 to 12 months.
Okay.
Sometimes it's a little less. We've had donors be with us 2 months. Some we've had 13 months. It's generally never over 12.
Okay.
But if a donor is still active in our program, we will let the family generally know and say, is it an issue? If the family wants the donor home at that point, we will certainly realize that request and send the donor home. But generally 6 to 12 months is our time frame, and at which time they'll complete the program, they'll be cremated, and then the family has the opportunity to have the cremated remains either sent home to them or interred in a mausoleum in the Memphis area. And again, that's a cost we incur.
Wow, I just think that's really wonderful, Robin. I do, because I think that for me, I just think that's a good thing to do. If a person donate their body to any kind of science, to me, even with your organs, and it's going to be a blessing and help somebody else, I just think that's a wonderful thing that you all do. I didn't sign up for that reason, because like you said, I don't know 20 years from now, what my situation may be, right? But of course, I want to do it because I just feel like it'll just be something that one way or the other will be a blessing if I'm accepted. They're going to find out something about me that's going to help somebody else. So really quickly, what are some of the things, I know you mentioned the hip, what are some other things that they do there to, as far as the research?
So MERI has supported so many different avenues of education. We work with neurosurgery, whether that's spine, skull, neurovascular, endovascular, cardiovascular, thoracic surgery, orthopedics, gynecology, urology, plastic surgery, general surgery and trauma, otolaryngology, ophthalmology. You can think of it. And we're so blessed to have done so from the gifts of all of our donors.
Okay.
People do this for so many different reasons.
Okay.
It's not just for, people think sometimes it's financial, but that's not generally the case. It's generally because people want to leave a legacy and have a peace of mind in the end.
'em. 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 your contact information if they want to know more about MERI Genesis. We'll wrap it up with that because we want to put that information out there, okay?
Absolutely. If you want to contact our Genesis Donation Foundation, it is www.genesislegacy.org. If you want to read about the MERI, it is www.meri.org. And our phone number is 877-288-4483.
Well, Robin, I would like to thank you so much for joining me today. I mean, we could talk about this forever and ever and ever, amen,
Yes.
okay? But
Yes.
unfortunately, we had 28 minutes to do it, but I thank you so much. And
Thank you so much for the opportunity.
absolutely, and I thank you for taking the time, and I just love it. I told you on the phone, I love your spirit, and I really enjoy speaking with you. I would like to thank Robin Bo-Zarth with MERI Genesis for joining me today to bring awareness to medical education research. Thanks for watching Medical Talk with Betty LaMarr on GHS-TV. Remember, you can also watch Medical Talk on Fridays at 1:30 p.m. on Comcast Channel 17. For more information on our programming, please check us out on the web at GHS-TV.org, where we are streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Betty LaMarr from all of us at GHS-TV. Thank you for watching Medical Talk, and I hope to see you again.